So my title is Chief Executive Officer of MetroWest Medical Center. That includes both campuses, Framingham and Natick, as well as our 4 major outpatient facilities that are in Framingham, Franklin, and Milford. So I've been running hospitals now for over 20 years. Ran Beth Israel Deaconess Needham for a while. Good Samaritan in Brockton. Was the first Chief Operating Officer for St. Luke's Hospital, which then became South Coast. And about 8 or 9 months ago, some of the board members called me, asked me if I would consider moving over, coming here. I actually wanted to work here about 4 or 5 years ago, but could not because I had a non-compete with my old company. So that went away, so I was really happy to be able to come back. So my role is really to make sure we deliver the highest possible care and meet the mission of the hospital. You know, this hospital's been here 125 years. We intend to celebrate that at the end of this year, so stay tuned for that. But we're very proud of the history and the legacy, and we have some great services here that people are very lucky and very blessed to have in the area. Not only is it 125 years celebrating, it's also celebrating what we've won this year. So we're now a top 100 hospital by health grades. There's only 100 of the 5,000 hospitals that win that award, so we're very proud of that. We have blue chip programs, as I call them. So those are programs, we expect all our programs to grow and get better, but our blue chip programs, we want to grow and get better faster than the other services, is sort of a definition. Our blue chip programs are cancer, heart disease programs, behavioral health. We believe we have the largest footprint or largest inpatient behavioral health program in all of New England for an acute care hospital, critical care services, and emergency room services. We just opened and started a Vinci robot, latest technology. It's about a $1.6 million machine. Allows our surgeons to do things in a minimally invasive way, and in many cases a more robust and better for their training programs. Helps attract new doctors who are trained on the robot as well. We're also upgrading our behavioral health inpatient service, as well as adding a new pharmacy that's being rebuilt basically, so we're completely upgrading the existing pharmacy and putting in $1 million in endoscopy equipment and about $1 million in radiology equipment. So we actually went out to the community and let them have the kids select the name. So the name we came up with was actually a contest, and we're very proud of that because we think it's another way to get young people involved in future healthcare and future healthcare opportunities for them. We could not do a job if we didn't have a good job if we didn't have the people we have surrounding the doctors, the nurses, everyone from the registration clerks, environmental services, the OR technicians. Many of our employees have been here well over 20 years, so we're very fortunate because we have an experienced workforce that has a lot of clinical skill sets.
Minimally invasive surgery has been around for a long time, and it offers many benefits in patient care. Much less pain, less time to recover, earlier return to work or normal activities. And now we have the Vinci robot, which allows us to do these minimally invasive surgeries better, with less blood loss and faster recoveries. This Vinci robot has been here since April, so we're 3 months in, and our practices are all thriving and getting much busier very quickly. It's a great technology. One of the great things about Vinci is it's applicable to many different surgical specialties. So we're using it here for GYN surgery, for hysterectomies, ovarian surgeries. We're using it for general surgeries such as hernias, gallbladders. It will be able to be used for colon surgeries soon. And then for urology, it's here for prostate surgery, which has not been done in our community for a while. We make several small incisions and it causes less pain. The difference is that we can now bring in the robotic system to do some of the hard work for us. The surgeon is completely in control of all their instruments at all times, so it makes our life a little bit easier in that it gives us full functional hands again, where we used to have to use straight sticks to do things. Now we can have full flexibility, like wristed instruments, which is beneficial. And the thing that I've noticed the most is really the visualization is so much better. We can see everything. so much better, much more detail, and it's in true 3 dimensions, which we've never had before. I think the hospital has shown a great dedication to patient care by getting us this equipment. This is expensive equipment. Not every hospital has it. We're very lucky to have it. And I think it shows their dedication to quality, which we've always had.